So this is going to be not just about the technique of actually doing crowns. So David Clark knows way more about that than I do, and certainly Richard are going to be way better at doing actual crowns with Bioclear. This is going to be about how you make a decision on a case-by-case basis, and especially for the young dentists who are just learning Bioclear, what is the thought process that goes through your head when you're trying to decide about where you do porcelain and where you do Bioclear? Because we know porcelain's been around a long time, and we know Bioclear's been around quite a while too, but most of us are relatively new at doing Bioclear, and so our experience level is more extensive with ceramics, especially if you're weathered like Richard and I and David. I won't say that we're old, but we're weathered, okay? And so this says, actually, I had a 29 years experience with ceramics, 3 years experience with Bioclear. Actually, I was wrong. I've actually been playing with it for 4 years, but official training is 2.5 years old for me. So obviously, my experience, I have a vast more experience with ceramics. And these are some of the considerations that I'm thinking of when I look at what I'm going to decide to do. Am I leaning towards, and I don't decide for the patient. Now, it's different if you have a patient like David just had, and the patient is saying, hey, I'm not going to do porcelain and I'm not going to do crowns no matter what. That's a different scenario. And I get those too. I'm getting more of those as time goes by.
Stop for a minute. I want everyone to listen to this very carefully. We've only been doing Bioclear and where it's been branded, where it's kind of a big deal for about, I don't know, Jeremy can help us out here, but Bioclear really only hit sort of like critical mass maybe 5 years ago, where enough people were doing it, where actually there was noise. The number of patients who are amputation-centric, ceramic-centric, margin-centric, cement-centric, endo-centric is going to just explode. And with 3M's now pushing this forward and doing lots of great branding of the Bioclear method, you're going to see more and more and more patients come in, and it's going to be just a tiny push between porcelain and composite. But they're going to say, like that guy that had dissolved his teeth, he says, I don't want my teeth cut at all. And you might say, well, you're crazy. You just dissolved 80% of your tooth or 70% of your tooth. Why do you care about another 10%? He doesn't care. He doesn't care. You're not going to cut any of my teeth. So this conversation's, so you need to add to this slide, which is patients come in demanding either Bioclear or none. And it's not, remember, at the advanced courses, we talk about the 7 different types of people looking for Bioclear. They're anti-cut, anti-ceramic, anti-cement. They're anti a lot of things. So you got to update that slide, because that to me now is a pusher. I'll let the patient decide sometimes, right?
Oh yeah, and I mean, even after I was made this slide and I was making the lecture, I think there's a whole bunch of things missing off this slide. I mean, Richard could add to this slide. I mean, these are just some of the considerations. This is like, you could go on and on. And I'm thinking about mostly anterior cases. I'm not even talking about posterior, because if we go into posterior, it's going to go into a whole nother realm, so mainly just talking about anterior. So I look at the age of the patient. What is your extent of your training with your modalities? How much experience do you have with Bioclear versus ceramic? The size, the complexity of the case. Obviously, as the case gets larger and larger, you may want to feel like you need help and you need a ceramist to get to help. Amount of tooth preparation to get the desired result. That's a big one, a really big one for a lot of patients, because like I said, a lot of patients don't want their teeth cut. So you are going to be, if you get trained in Bioclear and as your training progresses, you're going to be pushed by patients, just like that patient's pushing David. You're going to get pushed by patients to do Bioclear. So when I teach the regional courses before the chaos and the shutdown, when I was teaching regional courses, and I would tell people, listen, if this doesn't appeal to you, then don't get Bioclear trained, because once you're Bioclear trained, guess what? You're going to be doing a lot of Bioclear. because it is everywhere and it comes through the door. It'll come looking for you. Considerations for replacement or repairs, that is something that a good friend of mine, Tiff Qureshi, who may be on this feed with us today, he talks about, he's from London and he's very conservative. And he talks about there's going to be a replacement event at some point in the patient's life. And what does that replacement event look like? So if it's a young patient, if they're in their 20s, there might be several replacement events, more than several replacement events. So how do you go about that? Is there a difference in how you think about cutting off ceramics versus cutting Bioclear or redoing Bioclear? That's a big consideration. So the younger the patient gets, the less I'm thinking ceramics and the more I'm thinking Bioclear, okay? The hygiene habits of the patient, if the hygiene habits get worse, I'm probably thinking I'm going to be going in more often. I'd probably rather not have as much ceramics. I'd probably rather have more composite. It's just easier to go in and re-instrument with composite than it is with ceramics, okay? By the way, people make a big deal about cutting off zirconium. Okay, cutting off zirconium is nothing. You want to go through hell, cut off a big Emax case, okay, that's all bonded to enamel. Undersized teeth, when everything's bonded, you want to go through hell, cut that off, okay? That's what Tiff Qureshi is talking about, the replacement event. Okay, what's that going to look like? Okay, the hygiene habits of the patient, parafunctional habits of the patient. We'll talk about susceptibility of the patient to that last one, susceptibility to recession and periodontal changes. That is something that is hardly talked about. I've ever heard about talked about on the lecture circuit. I don't know if I've ever heard any lecture speaker talk about that. And it is a big consideration because I think Bioclear has a big advantage in that area. If you see a patient that's highly susceptible to recession and gingival changes, you can better believe your porcelain veneer case is not going to look real good down the road. Now, if they've got thick gingiva and they seem very, very stable, that porcelain veneer case is going to look much better at 5 years and 8 years and 10 years down the road than your porcelain veneer case at 4 or 6 years that already looks like all the margins are out in the air and things are staining and you're seeing those margins and you're seeing the interface. So that is something to think about. So we know ceramics have been around a long time and we know that we can do big ceramic cases. This is a case that my dad did many years ago and she actually works not too far from here. We see her very frequently, and her case is about 8 or 9 years old now and holding up very well. We know that ceramics can be durable and long-lasting. That's no surprise. We know that ceramics can be in the right mouth, in the right situation. We know that ceramics are beautiful. We have a technician who can really do nice work, and they can hold up. And we can get help on cases where we have dark roots, ugly teeth, staining, tricolored teeth, teeth in an arch where every tooth is a different color. And then you might think to yourself, you know what? I need help with this. I'm going to need a technician who can really get me out of this jam. And there's nothing wrong with that. And we know that, like we said, we know that in the right patient, the right situation, the veneers, if you look at the bottom picture, the veneers aren't looking as good as they did. We know that work will age, and we know that work's going to have to be cut off and redone. So we have to think about what are the considerations of the replacement. And we know that ceramics aren't going anywhere because, like in my world, this upper arch is an entire implant hybrid prosthesis with pink gingiva and all of that we worked super hard to make very natural for this patient. So we know that we don't have to worry about ceramics disappearing off the planet, okay? So why am I doing so much Bioclear all the time? If we know that ceramics can be good, they can be useful, why am I doing Bioclear all the time? And I had a patient ask me the other day, as a matter of fact, how often do you do Bioclear? And I told her, every day. And she said, every day? And I said, every day. And that's become sort of my new reality, is it's an everyday event. And why is it? We're going to go into why I do Bioclear every day. So this is a case that Frank Spear would look at and say, okay, this is crossover bruxism. Frank talks about when they brux very far outside the envelope, they have a tendency to get that V notch in the center. So that tells you that they're bruxing beyond the normal path. So part of my training is with orthodontics. So we usually do a minimal amount of orthodontics to get something like this started. I actually want to move her teeth out of the path of destruction. And so I do combination of ortho and simultaneous bleaching. So the sequence that I was trained is basically ABB, align, bleach, and bond. It's really easy to remember. Align, bleach, and bond. Or I like to say align, bleach, and Bioclear. So it's align, bleach, and bond in London, but also align, bleach, and Bioclear depending on what you need to do. So this is kind of unraveling the lower anteriors a little bit, getting them straightened up. And now I am doing Bioclear veneers on the centrals. Why just the centrals? Because that's all she wanted to do. She was only ready to do the 2 front teeth. Okay, interestingly enough. And finances were not the option. Finances were not the problem. There's not a money problem. I've known the family a long time. So I finished the 2 centrals. She's a little dried out, but the teeth are looking good, and I'm happy with it. And she's very happy with it. I saw her just the other day. She's had these 2 centrals now for about 2 years like this. And I saw her just a couple weeks ago, and she said, I'm going to come back and I want to do the next 2 teeth. That is a wonderful thing about Bioclear. And another thing that I've learned about the progression of composite is a lot of these cases that we do with composite compared to ceramics, these cases are always in progress. You notice how you have cases that are just, they don't go away. The patient comes back and wants to do a little more, a little more, a little more, a little more. And it's great because it's so minimally invasive. And you know why I realize one of the reasons they want to do that is because the experience of the treatment is relatively pleasant. If you think about what we're doing compared to filing down teeth, how many times have you done a reconstruction with ceramics and the patient says, oh, I'm dying for more? Well, after you file all their teeth down to little nubs and temporize them and pack cord in their entire mouth and take impressions of 10 teeth, they're not really in the mood for a whole lot more. But doing Bioclear or doing composite-based dentistry, it's fun for you and it's often fun for them. And they actually like to come back. They actually want to come back and they want to do more. So that's how she looks now. And so we're going to be getting to do her laterals coming up shortly. Now, the interesting thing about this case, we had proposed ceramics years ago.
Hey, David.
Yeah.
David, so sorry to bug you, but when you've seen in your case so many times you miss something with your first eyes, would you mind backing up? Because when you showed the immediate post-op, go back, immediate post-op,
right?
All that dehydration is off the charts, right?
Right.
And so when you look at these teeth, because there's no dehydration of the Bioclear teeth, the overall value of the other teeth, even though the teeth are darker than your Bioclear teeth, those white spots of hypocalcification are really, it makes your Bioclear teeth look dark, right?
Right.
And then when you contrast that,
totally back to normal. Yeah. And just awesome the way they blend in and things like that. You know, even with ceramics, I hesitate to do 2 front teeth, or I hate to do odd numbers of teeth. And now with composite, I do odd numbers of teeth all the time. I'll do 3, 1, all the time. And getting it to blend is much easier with composite-based dentistry than it is with ceramics, even when you're using a top-level ceramist. That's what's incredible. Even when you're using a top-draw ceramist, I find it easier to make things blend with composite-based dentistry. So we had proposed ceramics years earlier. Like we've known this patient a long time, and she rejected it. So it's interesting that this patient was this was a mock-up that we did. We did a mock-up for ceramics, and she didn't like it. Could our mock-up have been better? Yeah, the mock-up could have been better, but you know what? You look at that and you think, you know what? That mock-up looks pretty good. But she wasn't ready for it. She didn't want ceramics. She didn't want any teeth filed down. She wasn't ready for it. But then when I proposed to her, I said, hey, we could straighten your teeth a little bit. Let's do a little ortho. Let's do a little bleaching. Let's see how that looks. And then maybe we'll bond a couple teeth. Okay, that sounds great. Let's do it. And it's amazing how many patients are in your practice that you don't know would progress if you propose that. And of course, we have, I get a lot of referrals now from orthodontists for things like this. And you say, well, why didn't the orthodontist just close all the spaces? Well, it's not that easy. Her occlusion is matched in perfectly. Okay, he's got the occlusion where he wants it. Okay, a good orthodontist is not going to try to close all the spaces. A bad orthodontist is going to try to close all the spaces no matter what. That's a bad orthodontist. A good orthodontist knows when he's got the bite sunk in the way he wants it, and he finds somebody to fix a problem instead of trying to close all these spaces. So who are you going to do ceramics on it? This girl is less than 20 years old. Am I going to do ceramics here? There's no way, right? So it's a Bioclear solution, one canine. I try to minimize it. If you look at the space, you say, well, you'd be better off to split it into two teeth. But she's less than 20 years old. I want to minimize what I'm doing to her. I've got one canine now to look after. I've got one tooth to watch after. Okay, one tooth. And look at the beautiful integration you get on that palatal surface. All right, I had to do the other side, which was a smaller space. X-ray looks sharp. Okay, replacement event is going to be pretty minimal. Okay, I've got one tooth to look after. Now, this is an old case, old case. And if this case, actually, this patient pushed me into, like you're getting pushed into Bioclear. I told him, I said, this would be, you've got ceramics on the back teeth. You got a lot of mess in here. Let me just cut it all off. We'll do ceramics. No, he doesn't want to do it. Like you said, David, I'm lazy. I mean, if I can, I don't want to go through all this and do, he's like, no, you're going to do bonding. And I said, I'm going to do Bioclear. Yeah, you're going to do Bioclear. He knows all about Bioclear. He's been already reading about it. He's been, he's got his mind is made up. And I'll tell you, it's a mistake to talk somebody into something that they don't want to do. So if their mind is made up on ceramics, don't talk them into Bioclear unless you feel like you can't do it. If their mind is made up on Bioclear, don't talk them into ceramics, because if you talk them into something that they don't really want, you own it. You own it. If they make the decision, they own it. If you talk them into something, you own it. So here we go. Cleanup, disaster, decay on every tooth, every tooth, decay. Talk about caries retention. I did some caries retention on this one just to avoid pulp exposures. And here's my rough draft. I bring him back, clean it up a little bit, and I progress him along. Not my best case, but he loves it. He loves it. He's posting his own pictures on Instagram with his teeth, and bragging about his teeth to his friends. And I know I'm friends with his brother, and he says, Scott drives me crazy. Every time he talks to me, he shows me his teeth. So he's, minimally invasive. I didn't have to cut away any more than I had to cut. I just had to get the decay out. So this is the case that sparked David Clark's interest when I sent him this, and he said, no way. He says, you can't be doing this. I can't let you do this. I got to do some crowns. So this was one that I was planning on. This patient has limited finances. Somebody else is paying for the dentistry, and she wants to get done in one visit. I don't really know what's underneath this veneer. Maybe it's horrible. So I'm not making her a promise. I'm not promising anything I can't deliver. I told her, look, I'm going to try to get this done in one visit, but there's a good chance I'm going to need, you're going to get a crown. I don't know what it's going to be, okay? But I start to cut the veneer off, and this is one of those veneers that pops off real easy, okay? You know how you normally have to cut a veneer off? This veneer flies off, okay? no problem. It's leaking everywhere. But
David?
yeah.
I want to stop here, and I want to congratulate you on this amazing photograph. I want to remind everybody that you need to be documenting these cases and building your own libraries. And sure, you can use our stuff, but one of the things that's going to be building your Bioclear practice is this. When patients come in and say, why should I do Bioclear? You'll have more and more consults, and you can say, hey, I do porcelain. I think it's important to say, I do lots of porcelain, so that they know that you're balanced. And then you say, but one of the tiny advantages to Bioclear, which is maybe not tiny, is there's no cement. You show them a picture when the cement degrades, which it's always going to do. There's no cement in between your Bioclear and your tooth. And you know what? This chronic leakage creates a bunch of cytotoxins that makes the gums purple. So this actually creates poor pink aesthetics because of this chronic microleaks. That cement's been leaking for 20 years, David. Okay? And you know what? We're a little bit nervous about all these zirconia crowns where the cement maybe is breaking down a little bit sooner under zirconia unless you bond the zirconia, which brings its all other problems in, right?
Yeah.
So when you start talking to your patients about the difference between Bioclear and anything indirect, there's no cement in between. And I tell what the patient is, the tooth and the Bioclear are as one.
Yeah.
It literally becomes one with the tooth optically and structurally.
Yep.
Becomes one with the tooth optically and structurally. So I'm sorry to bug you, but that's
no. Great input. Yeah. And I don't have like a ton of cases in here, so we'll have plenty of time for talking about this stuff. I agree with you about zirconium as well. I mean, I have to work with zirconium all the time, but I tell, Diana's sitting right next to me, who you know, and I tell her she's a future dentist who's going to cut my work off one day and have to redo it. And I tell her, zirconium is an okay material, but it's not a great material. It's not a great material. And I think one day it's going to be replaced by something a lot better. You can't section it, you can't solder it, you can't bond to it. It never breaks except when it breaks, that kind of thing. So anyway, I'm cutting this veneer off, and you can tell, like you said, it's been leaking a long time. I still don't know if I'm getting this done in one visit, but I have a rubber dam on here because I'm planning on it. Because I'm going to impress David. I want to have something to show Richard too. I want to show Richard he can't be the only one who does this kind of stuff. So yeah, it looks pretty nasty. It cleans up. And it looks better to me than I thought. Okay. Now, if you look inside my matrices, for the people that are kind of learning Bioclear, those little bumps in there, I'm a big fan of little bumps. I do bumps and bridges. So my bumps that I place, those are bonded. And the reason why I use those is I like to pin the matrices against the adjacent teeth. Like David says, I'm lazy. I don't want to have to hold these matrices. I like it when things are so secure I could walk away, go get a cup of coffee, and come back. And they would still be sitting there. That's how lazy I am. So I trim the matrices. You notice in the last picture, there's some overlap. You see the overlap? I don't really want all that overlap. Okay, it makes it hard to recover my matrices. So what I do, I trim. I don't have to trim the cervical of the BT matrices, but I trim them so they line up as good as I can like that. Now, once it's like this, I cut them off level. I'll cut them level with that central. Okay, so I've got some extra to work with. And this is all taught to me by David Clark at the Learning Center and all the great instructors at the Learning Center. And then when I injection overmold, that's how it comes out. And we look at the palatal. So basically, what is it? It's a 360. It's a crown. It's a 3/4 crown. I don't know what it is. It's a direct crown. I mean, there's going to need to be a code in the ADA for direct crown. That's going to happen because, besides us, there's besides Bioclear, they're coming up with other ways to do direct crowns. So it's going to be direct crowns no matter what. So if you notice what's nice, though, look at this. I'm sandwiched in between metal ceramic and a ceramic veneer. And, and look at the blending, right? I'm sandwiched between totally different materials. I've got Bioclear between metal ceramic and all ceramic, and look how nice it blends in.